Hi, everyone. Welcome back to Clinician's Brief, the podcast, where we bring you the conversations behind our clinical content. I'm the host of this program, Dr. Alyssa Watson, and today we're going to be discussing a rare but pretty dramatic emergency, and that's uterine prolapse in a cat. Joining us once again is Dr. Liz Thomovsky, Professor of Emergency and Critical Care at Purdue University. Yes, hello, Dr. Liz. She is a returning favorite on our show, and she's here to talk to us about really how we can recognize this condition quickly, go about stabilizing our patient, as well as navigating the kind of surgical decision-making process that follows this presentation. So, hi, Dr. Liz. Again, thank you for coming back on the show. We love having you here.
Right, here I am. Talking about my favorite thing, reproductive emergencies. Just kidding. No one's favorite.
No one's favorite. No one's favorite. Well, maybe a theriogenologist.
Maybe.
Lots of people do I think C-sections and puppies. It's always an exciting time around. It's stressful, but it's an exciting time around the clinic, I think. Yeah.
I think I don't really, I just kind of discuss I don't know, the whole thing. I don't really care for puppies that have a personality. So 6 weeks plus, personally, I'm not a big fan. But yes, everyone else does. The students, the technicians, everybody loves it here at our school. That's true.
Yep. Speaking of which, in case someone has not caught your previous episodes, would you just quick run through your bio for us again? Let us know what you're up to.
All right, so I'm an exciting graduate from University of Missouri, Columbia for vet school. Went to University of Illinois for an internship. Then I was disenchanted with everything, so I went to out in private practice. I was like, I'm going to be a practitioner. I'm going to like that. So I was in Pennsylvania for 3 years. Found out that there was parts of it I liked and parts I did not like, including the puppy and kitten visit, which is one of the reasons why I said I need to go back and do something else. So eventually, I went back and did a residency in Missouri, and then I worked at Wisconsin for 3 years, and now I've been at Purdue since 2011, I guess, long time, since 2011 at Purdue. So yeah, here we are.
That was short and sweet and just what we wanted. So let's jump into uterine prolapse. Today's conversation was actually inspired by just a quick, blurb you wrote for Clinician's Brief for us on this kind of pictures in practice. And this is a very dramatic photograph that you submitted of this uterine prolapse. And our audience has really responded quite well to it. So that's why we decided to sit down and talk about this a little bit further. So just typical signalment in history. A cat comes in with a uterine prolapse. What kind of signalment is that usually?
So I actually looked up and down to see if there's anything in the literature about it, but there really was not. So it's going to be typically during parturition, when they're giving birth. So in my experience, it's always stray animals. Somebody brings in a stray, but I'm sure if you work in a place where you're dealing with catteries or cat breeders, it's going to be that type of clientele as well. So it's going to be your cats that are giving birth. So somewhere between 8 to 10 months, especially for the strays, probably up to 5 or 6, maybe 7 years if you're dealing with the actual breeders where they're using their breeding cats up until a certain age. So somewhere kind of young female intact types, and obviously they're intact, young female intact age group.
Right, excellent. And so, just like you said, oftentimes this happens surrounding parturition. Do you know, is it possible for a cat to have a uterine prolapse if she's never been pregnant?
I looked a lot again for this because I had no idea, because I saw the script, as you know, beforehand. And I was like, I have absolutely no idea. So I looked and I could not find anything. The most I could find was either post-parturition, so the kitten's already born, or there was a case report of a cat actively giving birth and actually prolapsing at the same time. But I could not find anything at any other time other than that. And I think that has to do with the fact that I looked this up as well recently, so I'm going to sound smart, but I think it has to do with the fact that it's hormonally induced, and they think oxytocin plays a huge part in it. And so oxytocin is only going to be released in large quantities, at the time of birth. So I think that's why. So to my knowledge, it's going to be while you're giving birth or afterwards, 24 to 48 hours afterwards.
Shortly afterwards. All right. And then does it typically involve both horns, or do we commonly see only one horn affected?
So in what I could find, typically it's going to be body of uterus always. And then, so it could be body of uterus and one horn, body of uterus and 2 horns. I actually have another picture I did not submit. It was dead, the cat, that's why. But it was the entire like Y-shaped uterus, like the 2 horns and the body that was out of the cat, nice and necrotic looking. So it's either gonna look like that, where it's very idiot-proof. You can tell exactly what it is, or it'll be the body and probably 1 horn, something like that. So I think the picture I submitted was probably the body. It's hard to tell. Probably mainly the body, maybe a little bit of 1 horn coming out. So.
Yeah. And that really kind of leads into my next question, which was, does the extent of this prolapse, just like you said, you've got that nice Y kind of idiot proof. Yes, this is what
Right.
I'm looking at.
Right.
So yeah, does the extent of the prolapse affect either your kind of certainty in the diagnosis, or does it affect at all your initial stabilization and treatment plan?
I think it doesn't really change what you do, because I mean, you're going to have to, make the tissue smaller, try to stick it back in, and or just get rid of it, one way or the other. But the nice thing about seeing the whole Y, the Y, the uterine body and horns, is exactly what it is. You're not sure, like, because otherwise you're like, is it a vaginal mass? Is it a vaginal prolapse? Is it something else? And that can be, when it's just the body, or just like a little bit of the body and a little bit of a horn, it's hard to tell the difference. But the Y is going to be nothing other than the uterus. So that's the nice thing about it.
So that helps us with diagnostic certainty.
Yep.
Yeah. Is it possible when this happens for there to be concurrent prolapse of other organs? Like, can the bladder kind of tuck itself in there, or the colon? And how would you know that?
Yeah, so I didn't know this till I prepared for this yesterday. But yes, apparently it has been reported that the colon and the bladder can be inside the prolapse tissue. So I have not seen that. I've only seen just the uterus there. But so then I looked at it, I was like, how would you know this? So apparently, obviously, the bladder is going to palpate as so the uterus itself, unless there's a kitten in there, should be kind of just thickened tissue, maybe a little bit of fluid in it. But if the bladder's in there, it should feel like an actual balloon type thing, because it's going to be a reasonably full bladder, because it can't empty. So that it'll feel like a bladder in there potentially. You can also ultrasound, and ultrasound will show you the fluid-filled uterus and or potentially the colon. Although I'm not really good at knowing what the colon looks like personally with ultrasound, but the bladder I could figure out. And then you could potentially X-ray as well, because and I think the most value of the X-ray is you're not going to see the organs inside the abdomen. So the only place they must be is out. That sort of thing. So any of those kind of things in combination can help you.
Yes, that reminds me of, I don't know, back when one time I was doing some research on pericardial diaphragmatic hernia, and it said one of the clinical signs was absent abdominal contents. Like, that's a bad sign. Absent abdominal contents.
Nothing's there where it should be, right?
Right. But you know what? I didn't even, I was thinking of other organs, but I didn't even think of a kitten. So obviously, if this is around parturition, you could have a kitten in that prolapse as well.
Yeah. Yep. The one case report again hadn't seen that, but the one case report I was reading did say that there was at least one kitten in the prolapse tissue in this one particular cat. I was like, oh, that's it. I was like, never thought of that, but it makes sense, right? Because you're in the midst of giving birth, and there it is.
Yeah. You had kind of talked about when we only have the body or just a little bit of one of the horn, how it can be a little bit difficult to distinguish between a mass or a vaginal prolapse. Can you kind of walk us through digital palpation and what anatomic landmarks you're feeling for to try to determine that?
Yeah, so the biggest thing is the uterine prolapse is like you take the uterus and it goes like almost like inside out and comes out. So therefore, you should be able to theoretically get your finger or some other instrument, blunt instrument, around it, and you should be able to go all the way back to like the cervix, because it's going to come out of the cervix. So it'll just kind of come out inside out. And so you should, if you can get down there and feel all the way down the cervix, you can kind of feel what the tissue comes out. Whereas a vaginal mass, it's just the floor of the vaginal vault just popping out. So you cannot get around that back to the cervix, because you have to go through the vaginal tissue to get to the cervix. So if you your finger goes in or the instrument goes in, it's like a blunt, not very deep spot where you're getting stuck. That's probably the vaginal tissue prolapsing out, or a mass coming out of the vaginal tissue. But if you get all the way back around on all sides, 360 to the cervical region, all the way back there, then that's going to be a uterine prolapse, so proven otherwise. So that's kind of the big difference, is how far you can get your finger back, basically.
Perfect. Excellent. And then we already talked a little bit about adjunct diagnostics. So, if you're not sure or you're worried about something like a kitten, take a radiograph or maybe put an ultrasound probe on there. My understanding is that, kind of in general, manual reduction of the prolapse tissue, you should try to manually reduce the tissue prior to going to surgery. What kind of sedation or anesthesia is generally required when we're attempting to manually reduce this tissue for these patients?
Before I answer that, one other thing I read yesterday was apparently I don't know if these were newer case reports, but they were, because I was under the same impression, always stick everything back in and then go in and do the surgery to remove it if you're going to do a spay. Actually, there were two papers I looked at that were actually saying if it's really necrotic, disgusting tissue, just to amputate the uterine tissue before and then go in and tie off everything inside. So if you are going to decide to replace the tissue, if it's really, really gross and nasty and necrotic, you may not want to stick it back in so it can cause more trouble. But if I am going to reduce it, I don't know. Again, I was looking for an exact protocol. I couldn't find one. So I think I'm just going to kind of tell you what I would do. So I would use definitely something, you need pain meds for sure, right? Because it's going to be uncomfortable. We're stuffing this back up into the abdomen, and we need the cat to be relaxed. So definitely an opioid. I should say one other thing. It depends a lot if the kittens are alive or not, and if you want to have these kittens nurse. Because if you want the kittens to nurse and get colostrum, and the mom is stable and doesn't have like a hemoabdomen from a uterus, like tearing the uterine artery or anything like that, you may want to have the kittens nurse first and get their colostrum before you do anything. Because once you start giving mom drugs, we're out of luck. Because then you're going to have to give colostrum sub-Q or some other technique like that, rather than letting them nurse. But if you don't need to worry about kittens nursing, I would definitely give an opioid of some sort, probably a full mu agonist if you have it, so like a methadone, a hydromorphone. If all you have is buprenorphine, that's fine. Just remember it takes up to a half an hour to be on board, so wait a little bit, like delay your procedure a little bit. And then it's always hard I think it's hard to just sedate a cat for this. I think you have to anesthetize her 9 times out of 10. I think you could try something like Kitty Magic. So with your opioids, you could try to add in a little bit of ketamine, a little bit of dexmedetomidine, and see if that's enough sedation. But I think you're probably going to have to anesthetize the cat. So I would use an opioid, and then usually I'll use, if I'm going to go and anesthetize her, I'll do an opioid, like maybe like an ACE promazine or something like that, or midazolam if she's kind of a little bit unstable. And then I like propofol. A lot of people like alfaxalone, and then I'll intubate her and put her on gas. That's probably the best way, because then you have control of the airway. The cat is nice and quiet, and then and she should be relaxed, and you can go ahead and take your time to try to get the tissue back in, because it takes some time to do it. So, but I think whatever your favorite anesthesia protocol is fine. Just make sure there's a lot of analgesia and make sure she's nice and quiet.
All right, we're going to take a quick break, and then we're going to come back and talk about that protocol for reducing. Okay?
Sure.
Looking for that special clinician or veterinary nurse to fill your job opening? Job seekers from all areas of veterinary medicine can meet their ideal match on the Clinician's Brief Career Center. It's the best place to post your unique job opening and know it will be seen by that special someone. Get started at cliniciansbrief.com/career-center. Okay, so you said this takes a little bit of time, to get the tissue back in. I've never had one of these cases. So, this whole thing was just absolutely fascinating to me. Although I have had multiple times, where I've had a male, a young intact male dog come in, and the prepuce is curled up and we're unable to, reduce the penis back into the prepuce. And it seems a little bit similar, kind of apply the sugar and things like that. So what are some of these techniques to, reduce the prolapse tissue?
Yeah, it's pretty much the same thing as when you've got like a prolapse penis or whatever. It's the same thing. So you're going to clean the tissue gently, right? So again, hopefully the cat's pretty anesthetized, because cats do not enjoy to be handled too much on a good day. So even just tap water to rinse off gross contaminations, because a lot of these stray cats, It's quite disgusting when it comes in. So whatever you need to do, just kind of first clean it with just tap water if you need to, then some saline, maybe a little bit of chlorhexidine, very diluted because it's mucosal tissue. So you don't want to put anything that's really caustic on it to clean it. Then you're going to apply things like 50% dextrose. I like chilled 50% dextrose because it's got the cold temperature and then it's osmotic. Some people use hypertonic saline. If you happen to have that, you can just squirt that right on there. You can put sugar granules on, like actual white sugar. Just make sure you're rinsing it off later, obviously, before you try to stick it back in. Cold water just in general works. And I have not tried this with a uterus yet, but I have tried it with a penis. But I've done a little bit of laser therapy. I'm just be careful because it is mucosal tissue that the laser setting is really for gentle tissue. But that actually worked really well in the last penis we had. so I might try it if I get one of these uteruses again. And then gentle massage because you need the veins and lymphatics to take away this engorged blood and engorged tissue. So you just need to kind of gentle that again, another reason for anesthesia, because you're going to gently kind of go from the distal part, kind of gently massage the tissue to try to get the fluid to kind of go back, into the vasculature. So and a lot of patience. Take your time, put the stuff on, wait a few minutes, come back, maybe apply some more cold water, apply some more hypertonic solution, that sort of thing. So very similar to a penis, very similar.
Yeah. How high is infection risk in these patients? You said, especially with these strays, they come in, are you typically starting them on antibiotics, right away when you see this?
Yeah, so again, it depends a little bit on how acute the prolapse is, whether you need to nurse these kittens or not, like whatever. Because if you have to nurse the kittens, ideally you're going to avoid antibiotics if you can, right? Or if you have to give them, you're doing something like an amoxicillin or something that, it'll be in the milk. Hopefully the kittens can tolerate it. But if it's a really acute prolapse, like it's a cattery, it's a good owner. It's not these shady people, but it's a good owner that brings it in right away, and it's really fresh, healthy looking tissue. You can probably just lavage the tissue off, replace it. And I don't know that you actually need antimicrobials. Like if it's really, really acute, you probably can avoid the antimicrobials if you clean the tissue really well. But if it's necrotic, gross, contaminated, then yes, I am using antimicrobials of some sort. And I'm probably going to wean the kittens in that case because it comes down to, if you want to save the mom cat, you're going to have to give her antibiotics so she doesn't get septic because that is definitely the risk from that. So it's a little bit of a judgment call depending on the situation. So.
Can you comment at all on, do you ever use oxytocin in these cases? I had, because I did a little research on this too, when we were going to talk about it. And I had seen some clinicians that talked about using oxytocin to kind of support the uterine involution. Are there risks of doing that? When might you consider that?
Yes, I have not done that because all the ones I've ever seen we spayed. So it was less of an issue because the tissue's gone. So it looks like, again, because I also looked it up, it looks like oxytocin is going to be when you want to try to use the uterus again. So it's going to be a breeding cat, that sort of thing from a breeder who wants to keep going as a young cat. So it sounds like, you're going to go ahead and get the tissue replaced in. And then it sounds like the timing was after you got the tissue replaced would be the best time to give the oxytocin to have the uterus involute. The only problem is oxytocin is potentially tied to why this happens because the uterine contractions, vigorous contractions sometimes cause the prolapse. So potentially you could re-prolapse giving the oxytocin. So I didn't see, because I tried to see if there was a definitive recommendation and I did not. It sounded like it was a little bit of a judgment call. Certain clinicians recommend it, certain do not. And it's going to be that low dose oxytocin, that 0.5 to 1 unit per cat, like just a really wimpy dose if you do give it. Don't do units per kg or anything like that. Just like half an international unit per cat, and that's it.
And then if you get the tissue back in, or we're gonna stay positive, we got our tissue back in, it was nice and healthy, then why is a purse string ill-advised for these, and what do you recommend to do instead?
So You have to go through the edge of the vaginal tissue to put the prolapse in, and it's just going to tear through because the weight of the uterus is so heavy against really delicate tissue. And so if it's going to reprolapse, it's just going to rip right through and then cause a bunch of damage to the vaginal tissue. So there's not a lot. Like really, you basically just get it back in, and plus and minus your oxytocin, and you pray that it doesn't come back out. If it's reprolapsing again, you're just gonna have to recommend spaying the cat. But from what I read, because I had not had one reprolapse either, because I haven't done a lot of these, just a handful. But to my knowledge, none of them reprolapse. So it sounds like if all the kittens are out and they're done actively contracting, and you get the uterus back in, like knock on wood, it's not going to reprolapse very often. So just avoid the purse string. Like don't cause more damage. Just avoid if it comes back out, just recommend spaying.
Okay. Yep. And again, leads perfectly into the next question. So when we can't reduce it, or they've reprolapsed, or for whatever reason, the reduction isn't feasible, what's your surgical approach for, going forward with the OHE? Do you just walk me through that?
I call the surgeons. No, I'm just kidding. I don't have to do surgery anymore. But yeah, so I kind of read two different things. So what I had done in the past, back in the day when I had to do surgeries on things, I had always pushed the uterus back in. So I had put out, done my hyperosmotic solutions, and cleaned everything off, and then put it back in the abdomen, and then off we went, and we made an abdominal incision and just spayed the cat if I was going to spay it. However, again, I was doing this preparation, and there were actually people that were saying, leave the tissue prolapse, just go intra-abdominally, pull in as much as you need to get your clamps on, and basically excise the uterine body and be done with it, and then just pull it out vaginally. So there is a camp that is doing that as well. So I think if the tissue looks disgusting or that just seems easier, like go for it. Regardless, you're going to have to make a decent sized incision to see what you're doing one way or the other. If you do get the one who wants to save the uterus because it is a breeding cat, you can tack the uterus to the body wall, basically, and or do what's it called? I wrote it down. Colpo suspension surgery, which is where you basically, kind of attach the bladder and uterus to the pelvic wall, basically, and they use that for the same surgery you use for like an intrapelvic bladder, just to keep things from wanting to go intrapelvically and come out. So I have not done a colpo suspension surgery. I could probably handle tacking the horns of the uterus to the body wall. So those are kind of the other options for the cat who's prolapsed more than once, but is so valuable they have to keep breeding it, or that you want to try to make it not happen again. Those would be your options. But again, thank God I don't have to do reproductive surgery, or really any surgery anymore. Thank God. Not my favorite thing to do.
That's okay. Everybody has their strengths, and there's people out there that love doing it. So yes. That's what, there's going to be something that I love that somebody else hates, and there's going to be something that they hate that I love. So
Oh, one more thing. I wrote my notes. I forgot to say, if you are going to amputate the uterus and not put it back in before you take it out, so things are anatomically a little weird, make sure you identify the urethra, because there are some reports of like actually when you cut the tissue, if it's out of the body and you just cut the uterus and amputate it, you can potentially take the urethra with it. So you don't want to do that. So just make sure you are catheterizing if things don't look, if it's a different anatomic layout than you're used to when you go to take the uterus out. So.
Yeah, no, that's a very good point. Any other, common surgical or even presenting emergencies you had kind of mentioned or alluded to before, when the uterus prolapse, there's a potential for like uterine artery to tear, hemoabdomen. So any other things that we should be watching out for from an emergency perspective?
Yeah, I mean, I think you're going to know if like something terrible, like the bladder ruptured, or you have a uterine artery tear and you have a hemoabdomen. Those cats can be very unstable, right? So they're going to have peritonitis. They're going to be shocking when they come in. If you do an ultrasound, you're going to see free fluid, which you didn't expect to see intra-abdominally, things like that. So obviously those are going to be game changers, right? When you see that, because your standard prolapse is a pretty healthy, reasonably healthy looking cat. It's BAR or whatever. And there's this disgusting tissue hanging out the back, that sort of thing. So if you don't see that, then you have to worry that something else is going on. And obviously if you are worried the bladder is out of the out of the cat, and you are going to try, I would probably try to put the tissue back in before you're cutting anything out in that situation, because you don't want to, again, amputate the uterus and bring the bladder with it. That would be disastrous, right? So I think just careful palpation, good exam, that sort of thing. And when in doubt, you're going to open the abdomen. So if things don't look like, if you can't find the bladder, when you go in there, don't cut the uterus. Don't amputate the uterus. Find the bladder and get it back into the abdomen beforehand, right? Stuff like that. So I think it's somewhat common sense, because it's just going to be, something doesn't seem right. Like things don't seem where they're supposed to be. The cat doesn't seem as healthy as it should. That sort of thing will kind of clue you in. So.
Yeah. Excellent. And you've honestly done just a fabulous job of kind of integrating some of my final questions into the whole discussion. We've talked a lot about, when we need to wean kittens, what we're doing there. I guess the final thing is just overall prognosis. And even if it's just your experience, do you feel like these kids have a good prognosis, or?
Yeah, I think as long as you can spay, like they didn't have a hemoabdomen and like the spay goes great, the cats are fine. Like you spay them, they're like, thank goodness, no more kittens, and they move on with their life for the rest of their life. It's the ones that the breeding ones are going to be the ones that are problematic, right? Because you're not sure they're going to have a successful pregnancy the next time. They're at risk of prolapsing again, that sort of thing. So I think the breeders, you have to warn, hey, you may be back in here again. Keep your eye on this cat. I mean, not that they're not going to do that, but those are the ones that's a little bit more concerning. Just like we have to do a C-section in a dog, you're just not sure how the next pregnancy is going to go. Same kind of concept. I did find, again, when I was looking things up, that if there is a potential to have like urinary incontinence with these guys, which I would not actually have thought of, either from damage to the urethra during the prolapse, or if the bladder has been sitting really, really big because it can't empty, because the urethra prolapses out with the uterus, the bladder stays behind and can't empty. They can actually get to detrusor and things as well, where they're going to have trouble urinating, at least temporarily, which I hadn't actually thought about that, because I have not seen the bladder prolapse, knock on wood. So if the bladder is involved, potentially you're going to have some urinary issues you might have to deal with. And obviously if the animal's septic, like they came to you so late that the uterine tissue was necrotic and they have bacterial, like septic peritonitis and things, they're going to be sicker, and that's going to be a more dicey situation. Hemoabdomens, if they're bleeding to death, that's going to be a little bit more dicey situation. But if you can get the peritonitis under control and or the bleeding under control and transfuse them, they again have the chance to do well, but they go from like your, $1,000 cat to your, $3,000 to $6,000 cat, because now you have to treat them for peritonitis and, transfuse them and things like that. But again, the prognosis is decent if the owners have money, if they have an owner, and if the owner has money.
Excellent. Well, this has been just fantastic. And I'm just so thankful that you agreed to sit down and talk for a half an hour about a picture that you submitted. And thank you for all your extra, research and homework. Sure. It's been fantastic.
No problem. Anytime.
All right. So you, as we have said, are just a returning favorite. You know that generally what comes next is rapid fire, but I thought maybe you might be getting a little tired of that. So we're going to play a new game today.
Okay, you'll see what it is.
We're going to try this out. Okay. So these are going to be emergency cases presented as a limerick, and then you get to fill in the last word.
Okay.
Okay. We're going to start with the first one. This one's we'll start easy, okay?
Okay.
Here we go. A young tomcat presented near shock. His bladder was hard as a rock. He was unable to pee, so we knew there was need to sedate him and get him
I would say the last part one more time.
Okay. I'll go through it one more time.
One more time.
A young tomcat presented near shock.
Okay.
His bladder was hard as a rock.
Okay.
He was unable to pee, so we knew there was need to sedate him and get him
I have no idea.
It was unblocked.
Unblocked. Okay. All right. That was bad. That was very bad. Okay. Maybe I'll do better on the next one.
Do you want to try another one?
My cat was distracting me. It's not my fault. No.
It's okay. It's not your fault. All right.
Let's try to get
now
this.
you kind of know how they work, right?
Okay.
Okay.
I'm looking for a rhyme. Okay. All right.
You're looking for the rhyme. Yep. You're looking for the rhyme, and with the limerick, the first two rhyme, and then the second two rhyme. Yeah. Okay. All right. Okay. Here we go.
All right, one more time.
All right. A schnauzer came in looking gray, not eating, just sleeping all day. His breath smelled quite sweet, and his heart skipped some beats. He was suffering from...
DKA?
Yes, you got it!
All right. Woo! All right, got that one. All right. Woo! Okay. Woo. All right. Yay!
Okay, last one. Ready?
All right, here we go. 2 out of 3. Go for 2 out of 3.
Yep, here we go.
Okay.
A poodle collapsed in the sun, unable to get up and run. Her sodium was low and her heart rate was slow. She was suffering from...
I want to say heat stroke, but it doesn't rhyme. Okay, but what's the word it's rhyming with again?
Sun and run. And this one is like it's the layperson name for the disease.
Okay, sun, run. Okay, I'm failing miserably at this one too. I have no idea.
Okay, it's Addison's.
Addison. So what? How does that rhyme with sun and run?
Addison?
Oh, okay, I guess so. Oh, come on, that was hard. Come on.
That was a hard one. All right. We'll work more on this game. We're going to need to work more on this game.
At least maybe different contestant. I'm terrible at this, apparently.
Dr. Thomovsky, thank you so much for joining us again. Thank you to our audience for listening. We hope that you'll come back and join us for Clinicians Brief podcast for more conversations. Thank you for listening to Clinicians Brief the podcast. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcasts on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@instinct.vet. Clinicians Brief the podcast is an Instinct Science production, produced by Alexis Ussery and hosted by Alyssa Watson.